Okay, Tet is one province located in the center of Mozambique. It's a big province. We are 2 million people. Health staff are 2,000. So only 63 are medical doctors. And the nurses are 300. So one medical doctor cover 30,000 people, and one nurse cover 8,000 people.
Well, I think there are a lot of barriers for people in Mozambique for having appropriate health, especially if you are a pregnant woman in rural area. First, you have to face, you don't have the power to decide at home. Either your husband or your mother-in-law will have to decide when to go to hospital. If the decision is taken, generally it's taken too late, and when after decision has been taken, there's the distance, there's no transport, there's no roads, and an alternative has to be found. When getting to the hospital, maybe you won't have immediate assistance since the staff might not be there. The only nurse working there might not be there. Even if she's there, she might not have medicines. If she have to, you have to stay in the hospital for a few days. You don't have appropriate place and friendly place for pregnant women to stay.
But we as NGOs also, we need funding from outside so we can help the government build health centers, health equipment. They need health equipment. Like in Tsangano, they've got only a pickup. They don't have the ambulance here. There's only ambulance from Angone. If someone gets sick here, need to transfer, the only solution is just to transfer to Malawi instead of carrying to them in a pickup. So you see, there's a lack of equipment, hospital equipment. Yeah. Also staff, there's a lack of staff, especially at the mother and child. In maternity, it's a big problem. Tsangana has got only one nurse who assists in maternity. Just imagine, this is big and people have to come. It's challenging. So they need support. The government needs support. Also needs support for training medical staff. Yes.
Mozambique is one of the countries in which the relationship among health personnel and the population is very, very poor. Italy is supporting this plan in the two aspects of management and especially training. So we are funding three institutions of health who are training health personnel. We are following the quality of these courses that we are funding. We are at the same time trying to invest in the rural areas. Our program is supporting 1/3 of the students that will reach the level of nurses for their year.
In Mozambique, as in many countries around the world, there are many barriers that people face in accessing the health services and the health care that they need. And this can be anything from living too far from a facility to not being able to afford the services or even the transport to a facility, in which case it's extremely important that you have an equitable health financing system in place so that people can access health services without fear of financial hardship. And then the list goes on of the barriers, and they include things like not having information that you need, to not having a trained health workforce in place, and not having the health personnel in facilities. And Action for Global Health is advocating for universal health coverage and believing this is a path to achieve the right to health. And we think that only through addressing all these barriers to healthcare will we achieve universal health coverage.
Porque es justo, quiero un mundo sano.